Om Shri Gurubhyo Namaha. Seeking the blessings of Lord Dhanvantari. A very good afternoon to one and all. I am Dr. H.S. Harshita, second year PG scholar, hosting second day of MANOPRABHUTVA-23, a national level webinar series organized by Department of Postgraduate Studies in Kaya Chikitsa, Government Ayurveda Medical College, Mysuru, on the eve of National Ayurveda Day and Golden Jubilee celebrations of Postgraduate Department of Kaya Chikitsa, GMC, Mysuru. It's indeed delightful to welcome you all for today's webinar on the topic Psychology in General Practice. And it's a proud privilege for Department of Kaya Chikitsa to have today with us a distinguished orator and an eminent Ayurvedic psychiatrist, Dr. Parvati Devi MP, Superintendent, Government Ayurveda Research Institute, Kottakkal, Kerala. As our guest speaker today, and Madam, we wholeheartedly welcome you for the session today. Extending our invitation and respect to our principal, Dr. Radhakrishna Ramarao sir, and our professor and HOD, Dr. Maitreya RC, other HODs of the department, staff and PG scholars of GMC Mysuru, and last but foremost, all the virtual participants of today's webinar. The perfect balance of mind, body, and soul is considered as complete health according to Ayurveda. Recent researches and statistics will tell that 1 in every 5 individuals have been suffering from one or the other form of mental illness. So good mental health or mental well-being is that one possesses a balanced mind, confidence, and self-esteem. A mental illness or a psychiatric disorder, which can affect more than just a mind, is a problem that significantly affects how one reacts, perceives, and enacts to a particular life situation. With the rising prevalence and more cases approaching Ayurveda, it's crucial for us to diagnose and manage the said conditions more efficiently. So with this regard, I once again welcome our eminent speaker for today, Dr. Parvati Devi Madam, for the session. Beforehand, I would request Dr. Hasina Begum to introduce our guest speaker to the audience.
Good afternoon, everyone. I welcome you all for the National Webinar Series MANOPRABHUTVA 2023. Myself, Dr. Hasina Begum. It's my great pleasure to welcome Dr. Parvati Devi, MD, Ma'am, for MANOPRABHUTVA 2023. Ma'am has completed her BAMS in prestigious institute Vaidyaratnam Ayurveda College, Onnur University of Calicut in 1992 and completed her MD in Manovignan from VPSV Ayurveda College, Kottakkal in 2015. And did her MSc in psychology from Madras University in 2004. Ma'am has served as a medical officer at Government Ayurveda Research Institute for Diseases, Kottakkal, Kerala from 1999 till 2010. From 2010 onwards, Ma'am is a superintendent in Government Ayurveda Research Institute for Mental Diseases, Kottakkal, Kerala. She was also chaired more than 5 national seminars on Ayurvedic psychiatry from 2001 till 2010. I am even happy to share that Ma'am was a chief organizer of national seminar on chief child psychiatry named Pratiksha in 2012 and also Susmitram, management of mild cognitive impairment, Kushruti, management of ADHD and many more. Creative ventures of Ma'am worked as a state coordinator of projects Manasika in 14 districts and Ashram depression clinics in 6 districts of Kerala under Department of Indian Systems of Medicine and National Ayushman Mission. Ma'am took creative measures for starting child psychiatry unit in Government Ayurvedic Research Institute for Mental Diseases in 2010. Ma'am initiated steps for eradicating mental disorders in specific village called Manaswastya Gramam and started Project Anavadya for the management of psychological issues among transgender population. Ma'am took creative measures for starting rehabilitation unit in Government Ayurvedic Research Institute for Mental Diseases in 2016 and initiated steps for COVID-19 related depression and suicide prevention campaign called Jeevamritam with Department of ISM in Kerala. Ma'am presented papers in different national and international seminars in the field of Ayurvedic psychiatry, including the following: European Academy of Ayurveda, Germany; Duisburg Medical University, Essen, Germany; School of Ayurveda Belgium, Nimans Bangalore, AIIA New Delhi, Global Ayurveda Festivals, World Ayurveda Congress and International Ayush Congress. I am very I am very honored to be a part of this webinar. Over to you.
Good
No, we can
afternoon.
kindly start the
Yes,
session.
sir. Okay,
Yes.
thank you. Good afternoon, all. And first of all, I would like to express my gratitude towards the organizers for this webinar, of the Mysore College, Mysore Government Ayurveda College is very favorite to us because my husband has studied PG there. So I think I have visited 2 or 3 times in your college, and I'm very happy to present before the students of Ayurveda College, Mysore. Okay, let me start. I want to tell about the psychiatric healthcare in general practice. All of you are doing PG in Kajikitsa department, but after the PG, you are going to you are all going to become general practitioners. And in general practice, always we have a confusion with these psychological issues. Many of the, I think more, nearly 50% of the patients are coming with, along with psychological issues, with some general diseases, they are coming with some psychological issues. Then we have to differentiate these psychological issues, and we have to address these psychological issues. Then only the cure of the disease will be correct, or a speedy recovery we can get by addressing the psychological issues too. So it's a mental health. Mental health. We can see that in the same thing. If the content or the matter is the same, our approaches will be very different according to our mental health and according to our emotions, according to our personality. All are different. All persons are different, and our approaches to the same thing will be different. So, if a person is mentally healthy, then for example, we like to hear music if we are very happy. Most of the people like to hear music. The music is getting by hearing music, we are getting very happiness everything. And but if we are in a stressful condition, we are very tense or we are very depressed, we do not like to hear music. So the thing is, the music will be the same, and the singers will be or we are hearing that type of music. But if we are in a stressful condition, we don't like to hear music. So according to our mental health or according to our attitude, this our approach to different things will be changing. So then this question, what is the order of mind? It is very difficult to answer. How we can say that a person is normal, completely normal? We all are experiencing some kind of mood fluctuation, some kind of anger, or some irritability. We used to experience these type of emotional issues, not always, in different times. But how can we identify that this is a disorder, or how can we differentiate this is a normal thing and this is a disorder? How can we differentiate it is very difficult to differentiate this normal emotional change and the disorder. And all these acts in tune with social norms, because the society is considering that one person is not normal. If a person is not behaving according to the rules of the society considers that the person is not normal. If a person is dressing in a different style, or if the patient is behaving in a different style, not according to the some rules are there in each society. the rule of the society in Kerala is much different than the society in US or America or in some different place. So always the society is considering that the person is not normal or normal. And we can consider whether, what are the characteristics of good mental health. If a person is mentally healthy, then he feels good about themselves. And then he feels comfortable with other people. There is no quarrel, nothing. So we have to say that all the people are not mentally healthy, because now in Israel and Palestine, always, and in Ukraine, everywhere there are issues, and they are not comfortable with other people, or the people comfortable with people in the other countries. So all are mentally not healthy. So that's why these things are happening, and able to meet the demands of life and express emotions in a healthy way. So, and then uses stress management. They can manage simple stresses of life by themselves, and they can cope up with the changes in their life. And then they will be assertive, active listener. They can patiently hear the other's voice, can a part of a team. They can involve in all the activities with friends, with relatives, with society, everything. So that if a person is mentally healthy, we can say that these characteristics will be there, and then the person is completely healthy. And in Ayurveda, in modern science, then there is a different classification of mental health and physical health. And now the health definition of WHO, they have incorporated the psychological health also and spiritual health also. But in Ayurveda, from years ago, we can say that everywhere there is a role of mind. Then in the while describing the etiology of a disease, while describing the treatment, everywhere the symptoms, everywhere there is a role of mind, or then there is a psychological aspect will be there. And in the Swastha Lakshana, Prasanna Atma Indriya Mina, and there are descriptions of Satvika Guna, and there are descriptions of Sattva Bala. Then the mind is very important according to Ayurveda. And I told you earlier that how can we differentiate a mental disorder from a normal behavior? That mental disorder is a behavioral or psychological syndrome. We have to say that. For example, uh, if many symptoms are coming together, if a person is not getting proper sleep, if a person is getting only 2 hours sleep, that we cannot say that it is a disorder. He can manage it himself, and there is no other issues because of this loss of sleep. He can do his daily activities properly. Then it is not, we cannot consider it as a disease. But along with these sleep issues, it is making very and this loss of sleep is making very depressed features to him, or he is having some what, general debility or weakness, and he is having some what issues like anxiety or depression, and other symptoms are coming along with this loss of sleep. Then we have to say that it is a disease, and it causes clinically significant distress. And these issues that we all are having some depression or some anxiety or sometimes we are feeling these type of emotional issues. But if we can manage it by ourselves, then we cannot. There is no need of considering it as a disease. But these type of issues, this type of depressed mood, or this type of anxious mood or anxiety or irritability, everything, these symptoms are causing some distress to us. we cannot do our job properly because of these issues, then we have to consider it as a disease. And it must not be an expected response to a particular event. If a nearest relative, for example, if a person's nearest relative dies, then there will be grief and he will be very, very distressed because of this death of a relative. But if it is continuing for more than 6 months, these type of this depressed mood and this crying spells, everything is continuing more than a particular period, or a person is having these type of symptoms without a cause. This death is a cause and it is causing distress. And if without any cause, a person is having this type of distress and every this crying spells and everything, then we have to tell, and if it is extending to more than a particular period, the sudden response will be there, but this response is continuing for more than a particular period, we have to say that it's a mental disorder. And then only, if these criteria are there, then only we can say that it's a mental disorder. Then prevalence of psychiatric disorders in general practice, 25% for 1 among 4 persons have some psychological issues. And 40 to 50% of general practice population. Then we can see that if a person is coming with some sort of pain, then if we talk them freely, or if we make a very good rapport with him, and if we talk freely, then we can identify some psychological issues with the patient person. And if we can address these psychological issues also, the cure will be very fast. Then, and these psychological issues lead to delayed or incomplete recovery from the physical illness. If a pain is there, the patient will be complaining severe pain again and again. If we address the psychological issues along with these physical issues, then the recovery will be fast. And the diagnosis also, in a general disease, there are too many investigations. We can diagnostic. There are lots of diagnostic criteria. Are that it's more easy to diagnose a physical illness. But for a psychological issues, first we have to but the difference from, or the deviation from the prakriti is the vikriti. So we have to assess the normal behavior or normal personality of the person. Then only we can diagnose that what is the change in their personality, or what is the change in their behavior, like that. In that case, we have to need a help of the bystander also in some cases. And in psychiatric disorder, no lab investigation. With any lab investigations, we cannot diagnose a mental disorder. We cannot see any physical signs of in a depression or in a schizophrenia. There will be no physical signs, no objective parameters. We have to depend the words of the patient or the caretaker or the bystander. No external validation in each case. Then depending upon their normal behavior, we have to assess the abnormal behavior. And the normalcy will be different to different people according to their personality, or depending upon their personality. Some people will be very short tempered in a normal behavior also. Some people will be very calm with very good sattvic guna. Some people will be rajasa, or some people will be tamasa. According to their prakriti, then we have to assess that whether he is more impulsive than if a sattva guna person is becoming very aggressive and very angry from a particular time period, then we have to think that there is a psychological issue. And so, depending upon their normalcy, we have to assess the abnormal behavior. And and the culture also, in some traits of some particular society, there is a different culture. So if some people they are not what custom they are not consuming alcohol, but in some other culture they are using alcohol, or it's allowed. And if a person is consuming alcohol in a non-alcoholic community, they will say that this person is abnormal, he is consuming alcohol daily. But in other community, they are using or they are taking alcohol daily, and if it is more severe, if it is very severe, then only they tell that the person is alcoholic. So, according to the culture, also it is different, and we have to assess with interview only, with a open communication with the patient. Only we can assess what is the problem and how can we manage it. There are too many types of like physical disorders. There are too many types of psychological issues, mental disorders. Then with severe mental disorder, like with psychotic symptoms, severe mental disorders will be there, or minor mental disorders there are, and organic mental disorders are there. That is the organic cause in the some brain lesions or some organic case in the organic reason in the brain will be there, and in that type of inorganic brain mental disorders we can do lab investigations like MRI and other investigations we can do, and we can assess whether there is any organic issue. And functional disorder. Functional disorders we have to assess with interview only. And coming to the etiology, there are too many factors, some biological factors, some hormonal issues, that type of biological factors will be there. Then neurotransmitters, serotonin, then dopamine, all the imbalance of these neurotransmitters can cause mental disorder. Then social factors will be there. Then some the issues in the society can lead to psychological issues. Then psychological factors, family problems, or some stress, along with we can say the sattva bala. If a person is with the hina sattva, then stressful factors can cause mental disorders, and all these factors come together in a some factors will be more or some factors will be less in a mental disorder. These type of factors can cause psychological issues. And when in a general practice, if a patient is coming with some physical symptom, when we have to assess that there is a psychological problem in that patient. In all cases, we cannot say that there is a psychological issue in physical disorders. So, in all cases, there is no need of asking, do you have any stress or do you have any problem? It is not needed. If some these type of some particular issues are there, if the unexplained multiple somatic symptoms, if a patient is complaining, then if you can identify that there is only it is only something other vada, or this is only vada vyadhi, or some other disease, if you can identify, if you can diagnose this, it's pure that type of disease, I think it will not be needed in the first visit. But if the patient is continued, but other than the normal symptom of a disease, there are much more symptom the patient is complaining about, unexplained multiple somatic symptoms and multiple visits. If you are prescribing medicine for 2 weeks and the patient is coming after 1 or 2 days, the patient is again coming, and that he is telling that I have some another problem, and then again you will prescribe medicine for 2 or 3 weeks, and within 2 or 3 days he is again visiting the doctor and telling that I have too many other complaints, like that. The multiple visits and the irritability with the patient's behavior, we can assess the patient's behavior. It's very restless. He cannot communicate properly. The eye contact will not be proper. If we ask, then the patient is not looking to our eyes, and the patient will be very irritable. And the hopelessness, the patient will be very depressed, and the patient is telling that there is no need of doing the treatment, and there will be no cure of this disease. Like that, the patient is very hopeless, and the fatigue, more than a severe fatigue is there, and a depressed look with the face itself. We can see that the patient is very depressed. If these type of symptoms we can see, or we have to think that there are some psychological issues, and if they have a difficulty in and if these symptoms are there, you just ask more. Then, with these issues, is there any difficulty in managing their day-to-day activities? With this problem, is it very difficult to manage your daily activities? And this increased tiredness. And so, is there any problem with their sleep? And frequently, these fatigue or other symptoms. With these symptoms, they cannot do that. Frequently, this type of fatigue episodes are there, and problem with the communication, whether any communication problem with their colleagues, family, or friends, a problem is there, and then crying spells, whether any. While telling, we can see the patient while explaining these issues with us, they will be crying. So this type of crying spells are there, and severe headache, frequent headache is there, and they cannot, if they cannot enjoy the humors in some depression and other type of conditions, they cannot involve in the very happy atmosphere, or they can involve in the, they cannot enjoy the humor, everything. And if there is if there are mood swings and change in appetite, or either loss of appetite or increased appetite, always eating and eating like that. And increase in smoking or increased use of alcohol or drug addiction, like that symptoms are there. Uh, you have to ask more about these details. In the poor mental health, if the patient is mentally ill, or if the patient has some psychological issues, they will be very reluctant to share their feelings. Some patients, but in some cases they can explain, but in some cases they will not share their emotions properly, and they will complain only about some physical issues. And and they cannot control their emotions also, and always there will be a pessimistic negative thought will be there. This will not be cured, and my life is like this, I cannot do anything, like that. And the problems, and if we ask, for some type of cases, if we ask that is there any issues like that, no problem, no problem is there, there is no problem, I'm okay. But with their other characteristics or behavior, we can assess that some psychological issues is there. Then stress control will be very difficult for them to control their stress, and sometimes they'll be aggressive or depressed, and they cannot face the issues. They face the conflicts like that, and they'll escape, or socially isolated. They'll be very socially isolated, or social withdrawal behavior will be there. Like that. And what is the relevance of identification of these psychological issues in a general care? For early diagnosis, if they are complaining some physical issues, this depression or depressed features or depressed symptoms of depression, it will lead to a severe depression. Or if we are identifying these issues before a or proper disease, or before becoming a severe depression or a proper depression, an early diagnosis will be possible in in a general for a general physician. If the patient is consulting a general physician, and if we can identify these symptoms of psychological issues, so early treatment is possible before becoming a psychiatric patient, we can diagnose and treat early. So, an early diagnosis and treatment is possible in a general medical atmosphere. And timely referral, if we are thinking that the patient is depressed or the patient has some other psychological issues, then we can refer that. Or with the depression, the chance of suicide, everything is more. So we can help the patient by referring to a psychiatrist or to a specialist. And first of all, most of the patients are coming or consulting a general physician. Then only they can understand that this is a psychological issue, or the doctor will tell that this is not a physical issue, some psychological issues are there. You have to consult a psychologist or psychiatrist, whatever it may be. And then but the early presentation is always to a general physician. Then they have to refer to a specialist. So the early diagnosis is always possible, and if we can manage it by ourselves, then it can reduce the healthcare expenses. If they are going to a specialist doctor, or the expenses will be more. So if we can manage these simple symptoms or these minor symptoms, then it will not lead to a severe disease, and the expenses will be less. And to reduce stigma also, nowadays, even in the this century, the people are thinking that if a mental disorder, if a person is having mental disorder, the person is always with mental disorder, that it's a psychiatric patient always. And there are lots of mental disorders with very good cure and very good prognosis. But this social stigma is still there. Then they are refusing to see a psychologist or psychiatrist. So if they can manage these symptoms in a general practice with a general practitioner, then they can reduce their stigma or among the society. Then improve access of care. Then assessment will be good in a general healthcare atmosphere. Improve prevention and detection of mental disorder, early detection. Better physical accessibility, better financial accessibility, and acceptability. Acceptability is more than a psychiatric hospital in a general condition. And coming to the symptoms of mental disorder, there are different types of symptoms. One, mood symptoms like depression, anxiety, fear, then some delusion, everything. There. Then cognitive symptoms are there. Then obsessions, attention and concentration, and executive functioning, memory, intelligence, social cognition, everything. This type of cognitive symptoms are there. Then behavioral symptoms, aggression, hostility, suicidal behavior, disorganized behavior. Then perceptual symptoms, hallucination, hearing some different voices, illusions like that. And somatic symptoms of pain and other type of symptoms will be there. First, to uh, to reach in a psychiatric diagnosis, we have to establish a good rapport. If we talk the patient in a friendly manner, and if the patient is thinking that the doctor can understand my situation, then only they reveal their issues. So the rapport is the main thing. First, we have to make a very good rapport with the patient, and then only we will get more information from the patient. And then we have to assess what are the psychiatric symptoms, are the signs and symptoms are there, what are the issues related to the patient. Then compare the present functioning with development stage goals in children and in other. If a 15-year-old boy is behaving like a 5-year-old boy, then we have to say that there are some psychological issues, and some here some patients, some bystanders used to say that the patient is a 30-year-old man, and he's behaving like a child. So the 30-year-old man has to behave like a 30-year-old man, and then if he is behaving like some another age children, then it's abnormal. So, and all the development in each stage, there are some, we know there are some certain behaviors, and we have to compare it with whether the patient is behaving according to his age or according to his word or his situation, like that. And then we have to analyze whether any problem is there. And in a patient with this type of symptoms, we have to listen actively and find out how their problem is affecting them, how much these issues, how much it is causing difficulties in their daily living, and what issues are most, whether family issues or his own psychological problem or some social issues are there. These type of issues we have to assess, and how can we help them, or how our treatment or our medicine or our advice can help them. And you have to put your leg on their shoe. That's an empathy. Then we have to understand them properly, and with our help, the patient can retain his mental health very fast. Then biopsychosocial and personal history of depression, family history, all this we have to assess the quality of interpersonal relationship, living conditions, social support, and how this is affecting their employment. These problems will be there. Then whether any suicidal ideation will be there. All this we have to assess. The major disorders are major psychiatric disorders and minor psychiatric disorders, major mood disorder, schizophrenia. These are the major and severe psychiatric disorders. Minor anxiety, depression, OCD, obsessive compulsive disorder, we cannot say that it can be severe. All these diseases can be severe, but in the first stage, if we treat it properly, we can manage it very easily. Disorder of sexual dysfunction, all this. And then in all these diseases like depression and anxiety, you can see many physical symptoms. Then in depression, you can see that a change in appetite, change in bowel function, dry mouth, palpitation, indigestion, all these physical symptoms will be there. And in anxiety also, appetite issues will be there, dry mouth, palpitation, nausea, loss of libido, sleep disturbance, headache, giddiness, all these type of physical symptoms will be there. And along with that, the psychological symptoms like thinking, issues with thinking, concentration, and some morbid thoughts, then sad mood, then in denial, lack of awareness of symptoms. Then they cannot understand what is their issues properly. Then speech, speech, then negative talk. Everything will be not good like that. Always negative thought will be there. In anxiety, you can see these psychological symptoms. They are very concerned about their ill health. They are thinking that there is some disease, or they are not healthy, or they are not in a good condition like that. And concentration issues will be there. Helplessness, fatigue, these different types of thoughts will be there. Want to run away from, if a situation is making anxious to them, then they want to run away from that situation. If a person is having some issues in or having some social phobia, having some issues in communicating with other people, then they will escape from that situation. That type of condition will be there. Then irritability or this type of psychological symptoms will be there in depression. And according to Ayurveda, all these are modern symptoms. According to Ayurveda, there are two type of in Unmada. It is reserved that Doshonmada and Bhutonmada, two types of Unmada is there. And Doshonmada, we can explain it through the accepted parameters like dosha, dhatu, that vata, pitta, kapha, unmada, that the nidana will be the what the factors that are causing dosha vitiation, and then the factors which cause more stress, or then psychological factors along with the factors causing tridosha vitiation are causing doshanmada. But in bhutanmada we cannot explain through these accepted parameters. There is no dosha vitiation factors, there is no such type of things. Only psychological issues are there in bhutanmada. With these psychological issues, some sudden personality changes will be there. That is the Bhutanmada. So, Bhutanmada is the sudden change of the personality without any dosha vitiating factors, and the Doshanmada is not like that. So Doshanmada, we can say that Doshanmada is psychosomatic. Somatic factors or this Doshakopa factors are there, and psychological factors, stressful factors are there. But in Bhutanmada, only psychological issues will be there. In Bhutanmada, the reason is Prajnaparadha, or and along with the Chitra, some vulnerable situations which are causing this condition more severe. So, because of this Prajnaparadha and the Chitra and this vulnerable situation, then personality changes occur, and it is leading to Bhutanmada. And according to the awareness of the concept of the affected thing, the Rakshasa Graha, Brahma Rakshasa Graha, Pishacha Graha, these type of concepts were there in the olden days. Then they they are thinking that this sudden change of personality will be according to their concepts and thoughts. That's a Bodhonmada. But in Doshonmada, the dosha vitiating factors along with the stressful factors are causing Doshonmada. Mainly Vata, Pitta, Kapha, Sannipata, Vishaja and Adhija Unmadas are there. In that also diagnosis and diagnosis is history taking and mental status examination. If you are thinking that a patient has some psychological issues, you have to take a proper history and you have to assess the mental state. How is the mental state of the patient? And then active listening, explore the triggers, etc. And for diagnosis, first we have to assess the appearance and behavior, how the patient is behaving, and the speech, how's the speech, is it very sad, it's very loudly, or it's a very slow, different types of speech characteristics are there, and how the patient's mood is there, and then thought, what whether there is any illogical thoughts are there or magical thinking, that type of thoughts are there, and whether the perception is proper, whether any illusions are there, or hallucination. If the patient is hearing some voices, the patient is complaining that I am always hearing some voices, but no others can hear that. That will be maybe some auditory hallucination. The patient is always complaining about hearing different types of voices in there. They're really they are thinking that they are perceiving that like that. And then cognitive impairment, whether any cognitive impairment is there. And according to Ayurveda, it's a Manapariksha. Ayurvedic scheme of mental status examination is Manapariksha. Unmadam is the Vibhrama of Mana, Manasa, Buddhi, Samyajnana, Smriti, Bhakti, Sheela, Cheshta, Achara. The Vibhrama, the impairment of these 8 factors is Unmada. So we have to assess whether all these 8 factors are affected. Sometimes only Mana, Buddhi, some factors only will be affected. Then we have to assess what are the factors are affected in this psychiatric condition. First, in the if the manas factor is affected, then chindyan arthana chindade achindyamsha chindata, the thought will not be proper, and the perception also indriya abhigraha, perception and motor control will be impaired. There may be hallucination or illusion, or the mental control is not will not be proper, and there will be different types of thoughts. And if buddhi is impaired or buddhi is affected, then nityam anityam iti. Priyam cha apriyam iti pashati. But they cannot differentiate what is good or what is bad, what is nityam and anityam, what is what are the factors they like or what they dislike. They cannot differentiate each things. And then mental deficiency will be there, the general information will be improper, immature behavior will be there, inappropriate laughing, crying, imitation of different sounds, all these type of symptoms will be there. This in a mild mental disorder, we cannot see the other severe symptoms like inappropriate imitation of different stuff. It will be in severe mental disorders, but other minor symptoms you can see. And samjnana is the agnyadidahanna buddhi. The orientation will not be proper. Orientation to time, place, and person will not be proper, and they cannot properly respond to their external stimulus. And smriti, the memory, we have to assess the memory. Natu smarati aidha, whether the memory, remote memory, the past memory or recent memory, and immediate memory, whether it is proper or not. And the bhakti, desire in relation to food. Yatra ichha purvam asit. If the patient is complaining that previously I wanted to take very hot food and everything, and after this issues, I like always I like cold things. Then or previously they were dressing very neatly and they like dressing or proper dressing image, but after these issues they are very careless in their dressing, hairstyle, everything. Then whether there is any change in their what desires, likes and dislikes, everything we have to assess. And then Sheila. Sheila is their habits. Akrodhana Krodhana Bhavati. If a patient is very calm in the normal behavior, and after this problem, the patient is becoming very aggressive, very angry, and very impulsive, we have to check whether this type of problems are there, and their mood temperament changes there, then whether any change in their physiological functioning and their leisure time activity. Like for example, if a patient like a person likes to hear music always, and after these issues he dislikes to hear music, he is getting irritated while listening to music. This type of behavioral problems are there, we have to check. And smoking, narcotics, alcohol, all this type of behavior is there, we have to check. And then cheshta anuchita cheshta, their psychomotor activities, how it's it. We have to assess their general motor activities, speech, facial expression, their postures, their inappropriate, this type of dancing, singing, this type of activities are there, or the motor activities are very, very reduced. They are very, very slow activities are there, whether we have to check. And then achara is ashauchadi ajanti, the Persian personal standard. They are neglecting daily routine, whether this symptom is there, or habit of over cleanliness. In cases like obsessive compulsive disorder, the person will be cleaning more and more. The over cleanliness will be there. Obsessions in bar, then according to social standards, whether they are behaving according to the rules of the society, everything we have to check. And if then we have to check these 8 factors, and with this we can get a diagnosis, and then we have to go for the treatment. We have to assess the patient thoroughly and go for the treatment. And in the treatment aspect, what we have to do? We have to do medicinal treatment, and then psychological support we have to do, and then social support also. We have to ensure that the society or the family members or others are supporting the patient in their bad condition. Then we have to, I told you earlier that we have to hear the voices of the, or we have to be patient, very patient to hear the complaints or the problems of the patient. And then if a proper rapport is there, we have to ensure the patient that I'm caring you, or not be the family support, or also or a nearest family member. We have to ensure that they are caring him, or there is somebody to care or to listen and that patient, that person with a psychological problem. And all this, there is a concept in the society that mental disorder, once a patient having mental disorder, it's not curable. Lifelong, they have to, they will be a psychiatric patient and they have to continue the medicine lifelong. There are different types of misbeliefs in the society, but after properly checking the patient, uh, what we have to convince them that the the type of the disease is curable with the medicines, it is easily curable. Like that, we have to give a proper support to the patient, and a multidisciplinary approach is needed with uh, medicine and counseling and other psychotherapy we have to do, and then proper diet is needed, and then also the medicines. So needs correction in the somatic and psychic level. And according to Ayurveda, Satorjaya, Yukti Vyapasraya, Deva Vyapasraya, these are the three types of treatment. And mainly, we in the hospital, in an institutional atmosphere, we can do Satvavajaya and Yukti Vyapasraya treatment. And in Yukti Vyapasraya, Samana and Shodhana are the in a OP outpatient department, we can do Shamana Chikitsa only. But if we are treating in a hospital atmosphere, and many of the patients are not willing to admit in a psychiatric hospital, in a mental hospital, because of this stigma. If you are treating them in a general hospital, we can do all this treatment in the IP settings, and we can easily manage many types of psychological issues. In more severe cases also, if the patient is not aggressive or not causing any psychiatric emergencies, then we can manage them in the IP level also. In minor disorders, we can manage the patient in the OP level with Shamana procedures. And by after starting the treatment, the maintenance therapy, after completing a IP treatment course, or after doing the OP treatment, we have to continue the treatment to improve their quality of life. If the patient is taking too many modern medications, there will be some drug-induced Parkinsonism, drug-induced extrapyramidal symptoms will be there, some giddiness will be there. All this, the patient, what patient's quality of life will be, we can do improve their quality of life by giving Ayurvedic medicine to the patient, and to control the recurrence. Many of the psychological issues are having some recurrence. The recurrence level is more in psychological issues because the patient will be with the Hina Sattva. All this, some precipitating factors will be there, stress causing factors will be there. So, if a patient is with Hina Sattva, the chance of mental disorder is more. So we have to control the recurrence rate. So the maintenance therapy is needed. The chikitsa, Shuddha chikitsa is to prevent disease, to cure disease, and to prevent the relapse. Then Shodhana, in all Unmadas, Vatanmada, Kapanmada, Pitonmada, Acharya is saying the Shodhana is the best therapy. First, we have to do Shodhana. Then, so Tadhasya Shuddhadehasya Prasadam Labhate Mana. The clarity of body leads to the clarity of mind. So Shodhana is the important therapy in psychological issues. And all this you know that Shodhana Samyak Lakshana, Vigadodmada Lakshana, Dhatu Samyak Lakshana, Swasthala Nirvachana, Lankhana Samyak Lakshana, all these symptoms are, all these Lakshanas are similar characteristics. So, if a Shodhana Samyak Lakshana leads to Manaswastya or Swastha, or a person is getting swastya after doing the Shodhana and other procedures. And Hridindriya Shirakoshta Samshuddhya Bhavanadihi Manaprasadam Apnodi. Acharya says like that. And in therapeutic approach, then this Shodhana, after doing Shodhana, correction at deeper and subtle level. And the Sroto Shuddhi is important. And by doing Shodhana, we are getting the Sroto Shuddhi. So, this is the cure, the level of cure or the recurrence is less. Because of this, we are cleaning in the root level. Shodhana, Virechana, Vamana, Vastinasya and Raktamoksha. And Purva Karma is always be there. First, I should tell the IP management, then then we can go to the OP treatment level. And for before doing Shodhana, we have to do Purva Karma. Purva Karma first Sneha Rukshana and then Snehapana. In Snehapana, in Vata Unmada, we can do Snehapana with Kalyanaka and Mahakalyana Krita. If the condition is with more Paitika symptom, if the patient is in Vata, we can diagnose Vata Unmada very easily because the Vatika Unmada symptoms will be there. Then the patient will be the activity, psychomotor activities will be very fast. The patient will be walking very fast and doing some actions, abnormal behaviors, and the speech will be more. And then sometimes this type of singing and dancing type of symptoms will be there, or then or some elevated mood. They'll be talking about more and more things. Some elevated mood will be there. This type of symptoms will be of Vata Nada, and in Paitika, the patient will be very aggressive, increased anger will be there, then destroying things and then arguing, that type of things will be there in Paitika Nada. In Kapha Nada, the symptoms will be of depression, that the patient will not be talking much and then neglect their daily routine and neglect personal hygiene. Then the appetite will be very less. That type of symptoms will be there in Kapha and so in Vadonmada, we can give Kalyanaka Mahakalyana Vikrita, and then Pitonmada, we can give Tiktaka Krita or Dhatriya Vikrita, and in Kapajonmada, we can give Panchagavya and Panchagavya Krita for Snehapana. And if the patient is having more thought issues, some this type of unnecessary, unwanted thoughts and repeated thoughts, this type of or delusion, not real, unrealistic thoughts are there, then we can do with Panchagavya type of Krita, and in Apasmara we can do with Kushmanda Swarasa Krita. There are different types of Krita for Snehapana, and if we can do Uttamanga Snehapana, then it will be better. And Swedana, after doing Snehapana, then we have to do Swedana, and then the first procedure is Vamana. Vamana, mainly Vamana is Vamana is effective in Kapha Unmada, but in all type of Unmada, Vamana is very good. Vamana is indicated, and then it leads to Hridaya Shuddhi. And more than the psychological, what their therapeutic effect, Vamana has some psychological effect. Why? Because many of the patients and bystanders are thinking that these psychological issues are because of some gara inside their body. Because many of the patients are approaching, if they have some psychological issues, many of them are approaching some spiritual healers or some religious practitioners like that. So they will tell that these issues are this. Sometimes it will be an increased anxiety or fear. If that type of symptom is there, then there these type of spiritual practitioners, religious practitioners will tell that this is some because of some gara or some toxic material inside their body. So they want to expel it out. Many people are thinking like that. Patients and bystanders are thinking like that. So they want to expel it out, or they request us that this type of something is there in their stomach. So we want to expel it out like that. So if we do Vamana, Vamana is a good treatment, and moreover that they are very satisfied after doing Vamana, and they are thinking that this has gone out, these toxic materials has gone out, and they are telling that after doing the Vamana they are very clear after, but these toxins have gone out, and after that they are very happy and very clear. So this type of psychological effect is also there in by doing Vamana. And then Virechana. Virechana is very effective, and it is more easy. For Vamana, we have to do, the patient has to drink a lot of milk and a lot of this Vamana Dravya, everything they have to, liters of milk and this medicine they have to drink. But Virechana with half glass of medicine, it's to administer the medicine, it's very easy. And then Virechana is also very effective in Vaidika patient. If a patient is very aggressive or with increased anger, we can give just Virechana only. Then also their anger level or their aggression level will become less. And it is most commonly practiced. Without Purva also, we can do Virechana. And then Ruksha drugs in Kapha Pitta, Unmadas and Snigdha and Vadonmada, we can use that. And Vasti also, after doing Vamana and Virechana, we can do Vasti. All the Shodhana procedure we can do in Unmada. Uh, Vasti, not only in Vadonmada, in all other Unmadas we can do Vasti. Vasti has a purificatory and pacificatory effect. If a patient is very reluctant to take medicine internally, we have experience like this type of patients, then they will not take the medicines properly. Then we can do Matravasti with all these medicines mixed with Dhrita. So a pacificatory effect is also there. And for Shodhana, we are doing Yogavasti with 5 Snehavasti and 3 Kashayavastis. For Snehavasti, we can use the Ghrita indicated for that particular Unmada. If the Vata Unmada patient, we can use Kalyana Ghrita, and Vaitika Unmada, we can use Tikta Ghrita for Vasti, for Snehavasti. And Kashayavasti, the combination is like Madhuta Iligavasti, but with the instead of Erandamula Gatha, we can use Yashti Gatha for Kashayavasti. And Doshaharavasti, we can use the Doshaharavasti chronic mental disorders and the patients with the negative symptoms, we can use Doshaharavasti. And the Kalka of Doshaharavasti is Vachayashti Hingu, the RV and Dasmi. That is a Dosha Haravasti and Kashaya Eranamula Patha, Yashti Patha we can use. And the proportion is as Madhutaili. And after doing the Vasti, we can go for Nasya. Nasya is also very effective in depressive disorders, anxiety, then thought problems like delusions like that. Nasya is, Tikshna Nasya is very effective. And the possession of Manasi Stringadaga after purifying the Stringadaga, but after purifying the Shiras, then the mind also will become clear. Then use largely Visha Sannyasa, like that. In that conditions also, Nasya is very effective. And Manaprasada is also the effect of Nasya. And then severe type of depressions, very severe chronic depression, we can use some Tikshna Nasya if the patient is not at all responding to the all the external stimulus, and if a condition is with us, if the condition is with severe depression, they will not talk to another people, they will sit idle in a room without any proper communication, everything in the if it is a very severe one, if we consider that it's a very severe one, we can do Churna Nasya, Thmana Nasya with the Sarshapa Churna on that type of medicine. We have to take care while doing Thmana Nasya, but it's very, very, very effective in this type of severe chronic mental disorders. And our Hingu Kalka also, our Vedanasya with the Hingu Kalka we can do, or Hingu Vacha Darvi, Hingu Vacha Daru Haritara Kalka, we can use in anxiety disorders and to control the delusions and auditory hallucination. This Kalka is very effective. And Vilyadi Gulika, Sarshapachurna, all these drugs we can use for Nasya. And Daktamoksha, we are not practicing widely. Siddhavedha, it's in text saying that, but we have no practical experience in doing Daktamoksha. And in Shamana Chikitsa, according to the dosha predominance, we can make different combinations of drugs. Internal medicine, Shankopushpi. Shankopushpi Churna is good in almost all mental disorders. In anxiety disorders, it's good. Anxiety disorders, we can use Shankopushpi with Yashti Madhu. Combination is good. And in conditions like alcoholism and substance abuse, we can use only Shankopushpi Churna. And in schizophrenia like conditions, we can use Shankopushpi, Sarpagandhi and Yashti Madhu combination. And in patients with disoriented speech, behavior like that conditions, we can use Shankopushpi, Vacha and Pushta, Amaya Churna. And in Kapacha like conditions, we can use Shankopushpi and Ashwagandha combination. And in anxiety disorders and in phobias, obsessive compulsive disorders, we can use Jadamanchi and Jyotishmati. Different types of combinations are there. And Kritas also. These powders we can use twice daily. And the dose also, the Yashti, Vacha, and Shankopushpa also we can give up to 1 gram only. Jadamanchi and Jyotishmati we can give to 4 to 5 grams. Ashwagandha also. All other Sarpagandha only we can give only 250 to 500 milligram only. 250 milligram, not 500. The combination we are giving only 500 milligram. This type of different powders are there. And Ghrita, this in Vadika type of condition, Kalyana Ghrita, and Mahakalyana, Panchagavya Ghrita, Panchagavya Ghrita in Kabhaja conditions, and Mahapaishajika Ghrita in anxiety disorders, in obsessive compulsive disorders. This Mahapaishajika Ghrita is good. And Tikta Ghrita in Paitika conditions, we can give the Tikta Ghrita. Then we can give these powders and the Ghrita as internal medicine in different type of conditions. And the Taila for external use, we can give Chandanadi Taila, Himasagara Taila, Madhyashthyadi, Ksheerabala, this type of oils we can give for external application. Then Manasamitra Vadakam, Gorochanadi Gulika, Vidwadi Gulika for Nasya, external use for Nasya. Mainly we are using for Nasya, Anjana and Dhupana. We can give Vidwadi Gulika. And Manasamitra Vadaka, in general practice, many of the practitioners are giving Manasamitra Vadaka for all conditions. It is not good for all conditions, and for regular use, it is not. We cannot prescribe Manasamitra Vadaka for a continuous use because it contains Sarnavasma, Rajatavasma, all types of this Vasma preparation. So we cannot give it for continuous use. But Manasamitra Vadaka is good to get good sleep. In general, if a patient is having a general disorder or physical problem along with some anxiety is there, then we can, Mansamitra Vadaga is good, but you can give, if a patient is getting good sleep, you can stop the medicine. And in irritability, if the patient is complaining about restlessness, or that type of symptom, Mansamitra Vadaga is good. If the patient is telling that they cannot sit in sit properly for a particular time, if he's then he wants to get up from that there, and then he wants to walk, and then again sitting, then this type of restless symptoms are there, then Mansamitra Vadaga is good. Gorojanadi is good in child psychiatry, children's conditions, to get proper vak shuddhi, to in learning disabilities, that type of conditions, Gorojanadi Gulika is good, and Vilwadi Gulika for Anjana or Dhupana in depression, anxiety conditions, you can do. And then after the treatment, after the IP management, after getting, if a patient is not with proper insight, after getting, after the IP management, then only we can give for a Sattva procedure. Or in mild mental disorders, along with the treatment, we have to do this Sattva procedures. And you know, Ahita, Artham, Ahitepyo, Arthepyo, Manonigraha, to control their mind from improper arthas. That is Sattva. With Sattva Vijaya, we have to mm, help them to attain Jnana, Vijnana, Dhairya, Smriti, and Samadhi. Jnana is the proper knowledge about the person and his condition, proper knowledge about his health and the present state, the present his living situation, he has to get a proper knowledge about itself. And Vijnana is the conditional awareness. What is the issue with them? And then what is the stress with them? And how can we manage it there? That the special issues, the proper knowledge about his issues, that is, we can help him to get the proper knowledge with Vijnana, with providing proper Vijnana, with the Sattva procedures, and to improve their dhairya, to improve, to cope up with the situations, to improve their dhairya, to get or to manage their situation, and to smriti. Smriti is how we can provide smriti is that we can say some examples that in this type of conditions we are getting good result with this type of factors, or we can ask the patient that in his other in his previous life, in if a special, if these type of condition, if he met with this type of condition, how he managed with the problem, and in the present situation, if he's not able to manage the situation, then we can help them previously how he managed with this situation, and then we can help to manage the present situation with medicine and our proper guidance. So this the smriti about their previous experience, we have to help them to provide, and samadhi, that some relaxation techniques also we have to provide. And the scope of Sattva Vijaya is to correct their chinta, vichara, upa, dhyana, and sankalpa. That is a result of Sattva Vijaya. And these type of other procedure we can do in the OP level also. This Shiropiju. Shiropiju is applying oil. It's not the Shiro Vasti type of treatment, it will be very difficult to do in a OP level, but Shiropiju is very easy. You can apply the oil on the head. And then Shiroleba is also pouring that Dhatri Churna. Dhatri Churna with buttermilk, mixing with buttermilk, keep aside for a night, and then after cooling, then we can apply on head and cover with a banana leaf. We can keep this medicine for 1 hour or 1.5 hours, and after removing that, the person can take bath. So it's good for getting good sleep, to control their anger levels, everything. It's good. In anxiety also, it is very effective. In Dhara also, in a hospital situation, we can do dhara. Dhara is Taila dhara. We can do Taila dhara in what, obsessive compulsive disorders, Vata and Mada, we can do Taila dhara. And the Takra dhara also, loss of sleep, I think we can do Takra dhara. In Kashaya dhara with the Ushira Kuatha, we can do in drug addiction to control the withdrawal symptoms, we can do Takradhara, Ushira Dhara, Ushira Kuatha Dhara, and Kuatha with Shita Dravya, we can do in Paitika, all type of mothers, we can do Dhara with Shita Dravya drugs, Kashaya with Shita Dravya drugs. Then Dhumapana or Dhupana, we can do in depressive disorders, in delusions and hallucinations. If the patient is having some thought issues, we can do Dhupana with Hingu, Darvi, Vacha, then Haridra, that we can do Dhupana. And then Anjana also with Villadi Gulika, we can do depressive disorders, anxiety disorders, in schizophrenia with the negative symptoms, we can do this Anjana. Then Talam for getting good sleep. Talam we can do with Kshirabala 101 times repeated with Kachuradi Churna. Kachuradi Churna we can do Talam. And these are the major treatment procedures. And in different disorders, in organic mental disorders, we can in Alzheimer's dementia, we can manage the symptoms with internal medicines and other procedures. And substance use disorders, first to control their withdrawal symptoms, and then after first procedure is to control the withdrawal symptoms in substance abuse disorders, and then Shodhana procedure, and then Shamana procedure we can do. And in schizophrenia, with aggressive or positive symptoms are very good with good prognosis, and with the negative symptoms it is more difficult. Schizophrenia also we can manage with the modern medicines also. If the patient is taking modern medicine, we have to continue the modern medicine. And then with the help of a doctor, we can taper the dose. And with Ayurvedic medicine, they can improve their quality of life. They can do their daily routine properly. Then we are getting very good improvement in schizophrenia also. In mood disorders, then the depression and mania will be this will be affecting internally, and then prolonged treatment. This will be some seasonal. Every year this type of symptoms will come. So prolonged treatment is needed in schizophrenia and bipolar disorders. And other neurotic disorders, OCD is a very common neurotic disorder, but it's very severe also. It take a long-term treatment for obsessive compulsive disorder. Generalist anxiety disorder is a curable disease, and we can do Sattva and yoga also. And this type of dissociative disorder and somatophone disorders, we are managing with Ayurvedic medicines only. And this other type of disorders are personality disorders. Personality disorder is somewhat difficult too, because it is always mingled with their personality or like their behavior. So it is very difficult to treat. But in some type of personality disorder, like borderline personality disorder, we are getting very good result. And in mental retardation, we are doing some projects on mental retardation. We can manage the associated symptoms because the patient will be with a poor IQ. So the other counseling and other methods are not practical. And the person will be there, psychological issues will be there along with the mental retardation. We can control their aggression level and other psychological issues we can manage. It is not a curable disease, so we can manage the associated symptoms. In children's child psychiatry, in the case of children, in ADHD, we are getting very, very good result. And in epilepsy, along with the modern medicine, we are getting very good result in epilepsy also. And in scholastic difficulties also, scholastic issues of the, we have to identify the problems, and in these type of diseases we are getting good result. Personally, I'm not going more. Then referral strategies we have to assess that. Then serious, if the patient with you is having a serious risk of suicide, then suddenly we have to refer in a psychiatric center, and serious risk of harming to others in a primary care facility if we are seeing these type of issues for a patient, and significant self-neglect and severe depressive disorder. All these cases, if they are severe psychotic symptoms, a lack of proper social support or treatment resistant, all these the treatment resistant and need to, and some other comorbid conditions are there, you have to refer, and it's very risky to treat by yourself. If these type of conditions are there, you have to refer to other center. And then while treating a psychiatric patients, we have to look after ourselves, because if you are dealing with the worries of the patients always, then we will also our sattva is we have to improve our sattva also to convince the patient or to talk with the patient. We have to improve our sattva. Or if we are neglecting ourselves, then we cannot do this type of treatment properly. So we have to be happy always, and we have to improve our sattva. We have to maintain our sattva. So that's important in treating. In general cases also, we have to talk with the patients, and we have to be pleasant always. So we have to improve our sattva always. We have to take care of ourselves. To conclude, it took a long time. To conclude, Ayurveda described the etiopathogenesis of treatment of Manasaroga in a very clear manner. And in the treatment, we have to focus on the special issues of the patient. Right? Treatment, by doing Shodhana, after doing Shodhana also, we have to concentrate what are the special issues and how to manage these issues, and how to cope up with these issues. Then only we can get a complete cure of the disease. And a weak mind. Hina sattva is always a factor. And after doing this, doing the sattva vajaya chikitsa, we have to improve the sattva bala of the patient. Then only they can manage their family, their situations, at their risks, everything. Then wholesome vegetarian food will increase sattvic guna, and non-vegetarian food and intoxicants increase rajas and tamas. That's not proven, we can say, but Acharya is telling like that. To promote Sattva, attain Hita Viveka, Dhi Dhairya Atmadi. To improve the Sattva, and yoga is always good to improve their mental health. Yeah. And this is all for today. And if you have doubts, you can ask. This is about the. I think it's very. I ran like a fast passenger. If you have any doubts, you can ask. But if we tell in details, it will take too much time to describe all the diseases. Just I just said about all these things. If you have doubt, you can ask. Okay. Thank you very much for your patient hearing. Okay.
Uh, Thank you, ma'am. It was indeed a brainstorming session, and it was a comprehensive presentation on all the aspects of how general practice and management of early diagnosis and treatment of mental disorders can be eventually managed. There are a lot of questions in the chat box, so I'll be posting them
I
on.
shall check.
Kindly answer the questions. Can we go forward, ma'am?
Okay. Okay. Relevance of mantra chikitsa is at first here.
It's on the screen, ma'am.
So, so, which kind of medication is helpful in that? We cannot say that which kind of medication is helpful in mental health. I don't know. I, I couldn't understand what you meant. That is, depending upon the dosha predominance, we have to select the medicine. In the if it's a Vadamada, we have to select medicine for that appropriate medicine for that particular dosha. We have to select. And Ghrida is good. Ghrida is always good. That type of medicine. Ghrida is. Okay. Next, when can we go to the next question? When patient was what? When patient was aggressive, can you share your experience in treating patient was aggressive? Then what can you do? Patient was if a aggressive patient in a hospital atmosphere, we have isolation parts, but in a general condition, we have to take care of that. If the patient, that I told, the situations where we have to refer a patient. If the patient is making harm to himself or others, as psychiatric hospital settings that is needed. Then there will be isolation wards, everything. Or the patient is with increased anger or the patient is aggressive, then we can do Virechana. Just doing Virechana with Avipatti Churna, Pitta then Avipatti Churna. The aggressive, the level of aggression or the level of anger is decreasing. The anger level is decreasing, but an aggressive patient, if he's making harm to others, then we have to refer them to a psychiatric settings. Okay. And Pittahara drugs are always effective in aggressive cases. Can you share experience treating patients with bulimia and anorexia? Bulimia, and first we can do some sort of shamana procedure. Then we have to assess what is the cause of it. Mainly it will be related with some depressive symptoms or some anxiety issues. So first we have to identify what is the issue of this, when it started and how it started, and what is the cause of this bulimia. Sometimes the patient used to tell that if the patient is feeling some sadness or depressed mood, then he is eating more, or that type of problem. And you have to address that depression. So we have to give medicine. But first, in this type of conditions, always shodhana is needed. But in anorexia, first do some shamana procedures like thalapodichil or dhara we can do along with internal medicine like Shangapushpa Churna and Ashwagandha is good, and also EST Churna, EST also good to control their anxiety symptoms. And after but in anorexia also, if the patient is after confirm that the patient is taking proper food, then only we can go for Shodhana procedure. Otherwise, we can do some Shamana procedures and Shamana medicines and treatment procedures. Then we can manage the bulimia and anorexia. Then Shodhana is needed always. Role of Adravya Chikitsa and Tadana, Prasana, Bhayadarsh. All these are good, but now the situation is very, very sensitive, and this type of Tadana is not possible now. And the patient, otherwise, they will complain in some human rights or what. These are not practical in the present situation, but this type of treatments are effective. And in some, but in all cases it will not be effective, depending upon the case. If the patient is what the patient, by understanding the patient only we can say that in some patients These type of Tadana and Bhaya Darshana will get some improvement, but you have to always you have to be very, very alert. Then sometimes it will cause some negative effect. But after understanding the patient properly, we can say that whether this type of treatment is effective for that particular patient, not in a particular disease or not in a particular condition. To a particular patient, whether it is effective or not, we have to assess. Relevance of mantra chikitsa. Mantra in a institutional settings we cannot do the mantra chikitsa, but if the patient is believing some what this type of or he is not an atheist, if he is a believer, then we can advise them to do according to their belief. But there are lots of fake practitioners out there in this type of religious practices. So it's very difficult to them to refer in a proper place. But if a patient is a believer, then we can advise them to do according to their belief. But that's also in an institutional level, and the society is very impulsive. We cannot advise to do in a proper type of procedure. Here, one patient, we are doing dhupana for many of the patients with anxiety. We are doing dhupana, and one patient complained to some through a advocate who is complained that we are here implementing some religious therapies like that by doing dhupana. So we have to take care of doing this. Next one. Can you please explain how different dosage of vacha is it? Vacha up to 1 gram we can use. Vacha up to 1 gram we can use with Shankhupushpa in vacha or Shankhupushpa, vacha and Amaya combination. We are giving up to 1.5 gram. Up to 1 gram, more than 1 gram, it is a one Madravya. It will cause nausea and vomiting. Up to 1 gram, we can. Next question. What is the avastha in Uttamamatra Sangamana? How practice Uttamamatra Sangamana? Depending upon their Agni, after assessing the Agni, we can give Uttamamatra. Here, in almost all patients, we are starting with 60 ml of Grida and increasing by 60 ml. And on the seventh day, we are giving up to 400, 420 ml. Not for all patients. For all patients, we cannot do, depending on upon their Agni and their Bala. We can give. We have given up to 600 ml for a patient with Prabha. Then, depending upon their Agni, assessing their Agni, but all patients will not, many of the patients will be very reluctant to take Ghruta. So, in all patients, we cannot see some X-Nigdha Lakshana, but many of the patients we can do. Shamana Sneha. Shamana Sneha. For almost all patients after discharging from the hospital or in OP cases also, we are giving Shamana Sneha. And we used to tell that after taking Ghruta for some particular 2 or 3 weeks, we used to tell them to take Virejan at home also. Only they can take Virejan in OP cases. Shamans, they have these type of Krita also. In Vatika type of condition, Kalyanaka and Mahakalyana Krita we can give in Paitika conditions, we can give Tiktaka, then Dhatriyadi Krita. In anxiety, in Kapajanmada, we can give Panjagavya, Mahatvanjagavya, and that is according to dosha. Or in anxiety disorders, we can give Mahapaishachi Krita. This type of Krita we can give. And from home, they can do Virajana once in a month or once in 3 weeks. Next was scope of awareness, substance use. Substance use disorders, we are getting very wonderful result, and the recurrence rate is very less compared to modern medicine. In substance use disorders, the first thing is to control their withdrawal symptoms. Most of the patients will be coming just after consuming alcohol, or the bystanders, the family members will be bringing them to the hospital. So we have to control the withdrawal symptoms. For controlling the withdrawal symptoms, we can give Shangupushpi Churna, or 2 gram BD we can give. Then Kharjuradi Mantha, like we can tell them to make a juice or juice with Kharjura. Then what the other Draksha, then Dhatri, then the 6 drugs are there in Kapchada. The Mantha, we can tell them to make a juice with this medicine. And BD, we can give the Kharjura Mantha. And then Dhara with Ushira Kwatha. Ushira Kwatha, Dhara, or Ajamodarka is also good to control withdrawal symptoms. Then Ushirakwatha, Dhara with Ushirakwatha. If we continue this for 1 week, we can easily control the withdrawal symptoms. And then after checking their liver function and all the other lab investigation, we can start Snehapana. If other things are okay, then we can start Snehapana. And the Pittahara Chikitsa is good. That we can start Snehapana with Tikta Krita. Then after that, Virechana we can do. Then Basti, Nasi, all the Shodhana procedure. And after that, we can continue the Shamana procedures. Then again, Talapudslor, what Thara type of treatment also we can do. And the internal medicines, they have to continue the internal medicines. Then the craving, everything is reduced, and we are getting very good result in substance use disorders, alcoholism, various substance abuse. Nowadays, mainly the MDMA, then other type of drug addiction cases are there. Lots of cases are there. And rehabilitation, if the then we have to give the counseling to family members also. Sometimes they are the children, they are the peer group pressure will be there though. So we have to tell the bystanders that they have to take care of the child, whether they are the child is going to the same company or something. And if a family issues there, if a husband is an alcoholic, and that's because of the family issue, we have to counsel the family also, wife or parents also. We have to give counseling, proper counseling, along with the Shamana treatment procedure. We have to give proper counseling to the person and to the patient and family members. The counseling is important to control them. And then we have to convince them the bad effects and everything. And we have to manage the family situation also. So we can easily control the drug addiction. Stammering treatment. The stammering is also always related with some anxiety. Then this Gorachanadi Gulika is Gorachanadi Gulika 1 PD we have given. Other, what other medicine? In others, mainly stammering is related with some anxiety. We can give then Jadamanji Jyotishmadi Churna, or if it in a small child, we can tell them to make a decoction or kashaya with Jadamanji and Jyotishmadi. Just boil this powder with 1 glass of water, make it half glass, then the child can take BD. And then Mahapaishajika Krita. The Gaurajanadi Gulika BD can give. Then Jaramanji Jyotishmati the Kashaya we can give. And then Mahapaishajika Krita Depending upon the child age of the child, you can select the dose, half teaspoon or 1 teaspoon at night. You can give. And dhupana also. Dhupana, vacha, jadamansi, haridra, daru haridra, hingu. All this with this medicine, tell them to do the dhupana. Dhupana reduces the anxiety, and after controlling the anxiety, we can control the stamina. Okay. Next one. Please wait a minute. Psychiatry, this is always needed because in general practice we are studying a very, very small portion of psychiatry in the syllabus. But in the patients, coming patients are, I told you that more than 40-50% of the patients are coming along with some psychological issues. And the many of the practitioners they cannot differentiate what is anxiety or what is depression or what is schizophrenia. Many of the practitioners are referring us that this patient has some depression. You just examine the patient like that. Sometimes this will be very severe schizophrenia. We are not able to understand or differentiate what is schizophrenia and what are the conditions. So we have to study more in psychiatry. Most of the people are not aware about the psychiatric conditions. To overcome limited and experiential in the now also they are in the central council now they want to stop the MD in psychiatry. They are telling that in North in the MD psychiatry scope is very less, so they want to stop MD psychiatry. If there are doctors or Ayurvedic psychiatrists, then only they can treat patients. If there are psychiatrists, then only they can understand what is the chance or what is the capacity or capability of Ayurvedic psychiatry. If they are stopping all the MD psychiatry, then there will be no psychiatric specialists, and the general practitioners will treat psychiatric cases. Then, if they cannot do it properly, then the end result will be Ayurveda is not effective in psychiatry, like that. If they stop, or if the condition is like this. Ishwara, as I said, we get post preparing psychosis can be please. I haven't used that. I don't know about that. We are not using Rasauchatis because in psychiatric conditions, the patients has to take medicines for a long period. So if you use Rasauchatis, I don't know the safety of these medicines for a continuous use. So we are using only herbal medicine. We are not using Rasauchatis. I am not experienced with that. Next one. Kiratatitamula Patrakrata is effective Atinitrata. Special epilepsy. Treatment. Kirata. I haven't used, we have not tried this Kirata Tikta Mula. In this type of condition, Adinidra or narcolepsy, we are using some Tikshna procedures like Anjanam, Nasyam, and to control the Kapha, Anjana, Nasya, Dhupana procedures we are using. And Shodhana procedures also. I don't know the this one. We are treating with this Tikshna procedures. Nasya also good. Churnam, Kalka Nasya is also good. Adinitra. Next, bipolar disorder manage aggravated Vatapitan. Then this Shodhana Chikitsa is always needed in bipolar disorder. Sometimes there will be there is no we have to manage the mood balance. Mood should be balanced. There is no mood elevator or depressor. The we have to manage the mood. Or, so in that type of conditions, panchagavya krita, panchagavya krita is always good. In depressed condition or mania conditions, it is very effective. And after doing shodhana, we can control these mood fluctuations. First, if they are coming in a depressed mood, we have to take care. After, if the patient is coming with a depressed mood, we cannot do some strong or tikshna procedures. Then the chance of mood change to an elevated mood is there. So we have to control the mood. And this type of shodhana procedure, we can do all the shodhana procedure. And Panchagavya or Mahatpanchagavya Krita is good. And then it will not change a person to elevated mood. But while doing Nasya and other procedure, depending upon the condition, we can do some mild procedures in manic condition and also in depressive condition, and continuous medication and repeated purificatory procedure. Shodhana therapy is needed. If it is a seasonal affective disorder or whatever it may be, sometimes the patient will be coming with a manic condition, and some another time it will be with depressive symptoms. So first do Shodhana procedure and then continue internal medicine, and after 8 or 10 months we can do again a Shodhana procedure. So 2 or 3 consecutive Shodhana procedures, Shodhana therapy is needed in bipolar disorder. Then we can control the mood change easily. Okay. And antisocial personality disorder, many of the patients, they will not consult a psychiatrist or doctor to control the antisocial personality. Some patients are, if the patient is coming with some other disorder or some bipolar disorder, if they have some kleptomania and other type of symptoms, you can treat along with the other issue. But in personality disorders, mainly this type of borderline personality disorder or anxious personality disorder, these type of patients only approach a doctor. A thief or a criminal, they will not approach a doctor for the treatment for that. Antisocial, it's a pitta predominant disease, and if that type of persons are coming, we can do some pitta shamana procedures and pitta shamana shodhana procedures, but we are not treating much. They are not coming. That's why. Below the Kulika in OP level, if Kalkanasya we are doing with Hingudarvi and Vacha, in the OP level, it's very difficult to prepare. In OP level, we can tell them to do in depression, below the Kulika is good. In anxiety conditions, also, it's good. Just grind the below the Kulika and filter it properly, then apply on nostrils. I think one tablet of the only 3 or 4 drops in each nostrils mixed with water, not in a thick paste. Tell them to make a loose paste with villadikadiga grinded in water. 3 or 4 drops. Okay.
Thank you, ma'am. Here we come to the end of the question session. And hereby, I request now Dr. Annapurna, Assistant Professor, Department of Kaya Chikitsa, Government of the Medical College, Mysuru, to address the session.
It is indeed an honor to have you here, ma'am. You have given your enormous experience in a nutshell, the role of psychiatry in general practice. You started with both what is a good mental health, how a person with good mental health will be, and bad, both the side. You have explained very well with the etiologies and various treatments, and you have highlighted why a psychiatric analysis is important in a general practice, which was indeed a very informative session, and it was very useful for our PG students. I think we can understand with the questions they have put here, and the answers which you have given or clarified the doubts was also indeed very grateful, ma'am. We are on behalf of Principal and PG Department of Thai Chikitsa, I thank you for your precious time and knowledge. Thank you very much, ma'am. We expect same support from your end in our future endeavors. Thank you once again.
Thank you. Thank you.
Thank you, Dr. Annapurna Madam, and I once again thank Parvati Madam for giving us beautiful insights on the supposed topic. Here comes the end of day 2, MANOPRABHUTVA-23. I will meet again tomorrow at the same time, 2:30 p.m. And tomorrow the session is on the topic Ayurvedic Understanding and Management of Mood Disorders by Dr. Suhas Kumar Shetty, Principal and Medical Director, KLE. Welcome. With this, we come to the end of today's session. Thank you. Thank you, one and all.